Hi, I'm Sarah, and welcome to the Spoonie Life and Beyond. Just letting you know that I'm not a medical practitioner and I'm not giving out any medical advice. It's just here for awareness purposes only. I am also vision impaired, so you may find that I won't be looking at the camera. I do apologise. I also do text to voice. So if you do find that I pause or get lost, it's because I may get myself lost or need to catch up or fall behind on my program that's assisting me. I also do apologise. This is take two, as I did have someone come and knock on the door while I was doing take one. So let's get started again on Behcets disease. So let's dive into our deep dive. So Behcets disease, also known as Behcets syndrome, people also refer to it as Behcets syndrome or Behcets disease. It's a rare disorder that causes blood vessel inflammation throughout your body. So I personally myself have Behcets disease. So I will actually be adding in some of my personal experience as well, because no person has the same symptoms as the next. So the disease can lead to numerous signs and symptoms that can seem unrelated at first. So they can include mouth sores, eye inflammation, skin rashes and lesions, and even genital sores. So the treatment involves medications to reduce the signs and symptoms of Behcets disease and to prevent serious complications such as blindness, which has now happened in myself. I'm now legally blind. So symptoms for Behcets disease vary from person to person. So they can come and go or become less severe over time. And signs and symptoms depend on which part of the body is affected. So areas that are commonly affected by Behcets disease usually include the mouth. So you can get really painful mouth sores that look like canker sores, and the most common sign of Behcets disease. So that I usually get them as well. That will usually be, one of the first signs that I'm going to have a flare up, and I'll usually get over 20 of them at a time. Luckily, at the moment, they do actually have a new treatment out for Behcets that does really help with for most people. It helps with the ulcers in your mouth, to prevent ulcers in your mouth when you get a flare up. For me personally, it has helped. So when I get a flare up now, I'll generally maybe get one or two ulcers compared to 20 to 40 ulcers in my mouth. And when you do get those ulcers in your mouth, they are so painful that it's very difficult to eat and drink, and sometimes even difficult to talk. So they begin as round lesions in the mouth that quickly turn into painful ulcers, and they usually can take up to a few weeks to heal, and they quite often do reoccur. So there's also the skin is affected. Some people develop acne-like sores on their body. There's also others who develop red, raised and tender nodules in their skin, especially on the lower legs. There's also genital sores. So they're red open sores and can occur on the scrotum or the vulva. The sores are usually painful and can quite often leave scars. So the eyes, you can get inflammation in the eyes, which is known as uveitis, which causes redness, pain, and blurred vision, typically in both eyes. And And in people with Behcets disease, the condition can come and go. So when I first started having issues with my eyesight, it would come and go, and it would be treated by methylpred infusions. Unfortunately, this time when I had issues with my sight going, unfortunately, I lost my sight very, very quickly, almost overnight. And by the time we got to being able to treat it, it was too late and the damage had been done. So there's also the effects on the joints. So there is joint swelling and pain that often affects the knees in people with Behcets. But it can also affect the ankles, elbows, and wrists. So generally the larger joints. And the signs and symptoms can last for up to a few weeks and can go away on their own, or you may need some assistance, as mentioned before, from immune suppression therapy or prednisolone. There's so many different ways that immunologists and rheumatologists each try to treat Behcets disease, because as mentioned before, no two people are the same. So there's going to obviously be different treatments, as there is no cure. There is also the blood vessels. So there's inflammation in the veins and arteries, which can cause redness, pain, and swelling in the arms and legs. And which can then cause a blood clot. Inflammation in the large arteries can lead to complications such as aneurysms and narrowing and blockage of the vessels. There's also the digestive system. So a variety of signs and symptoms of the digestive system being affected is usually abdominal pain, diarrhea, and bleeding. Unfortunately, there also can be brain involvement. So inflammation in the brain and nervous system can cause headache, fever, disorientation, poor balance, or strokes. So, when you're starting to have a flare up, it is good just to keep a track of what your symptoms are, keeping in contact with your medical team, advising them of anything that you are concerned about. Because flare-ups, unfortunately, with Behcets disease can happen out of nowhere. They can become very severe very suddenly, as I mentioned before, like with my eyesight. So with the diagnosis, no test can determine whether you have Behcets disease. So your doctor will rely on primarily your signs and symptoms and your medical history, because nearly everyone with the condition develops mouth sores. Mouth sores that have recurred at least 3 times in the last 12 months are generally necessary for a diagnosis of Behcets disease. In addition to a diagnosis to Behcets disease, it also requires at least 2 additional signs, such as recurring genital sores, eye inflammation, skin sores, and you may also need blood tests or other laboratory tests just to rule out other disorders and conditions. So there's a pathogy test they can do in which your doctor inserts a sterile needle into your skin and then waits about 1 to 2 days and then re-examines the skin. And usually there'll be a small red bump that forms under your skin where the needle was inserted. And then there's almost like for me, my reaction was also like a bullseye on a archery target that almost looked like the Lyme disease spot as well, but in a bruised manner, which is indicative of Behcets disease. And also another thing that they've found as well is that that's common in people with Behcets disease is that if they ultrasound your femoral vein, there can be the vein wall can be thickened, and that can also be indicative of Behcets disease. So with the treatment, there is no cure for Behcets disease. So if you have a mild form, your doctor might suggest medications to control the pain and inflammation of the flares. Um, you might not need medication between flares, so they may just intermittently give you medication. Or whereas for myself, I am always on medication. I unfortunately can't come off medication. Um, so, for more severe signs and symptoms, your doctor might prescribe medications to control the Behcets disease throughout your body, in addition to the medications for flares. Um, so, treatments for individual signs and symptoms of Behcets disease, medications to control signs and symptoms you have during flares might include skin creams, gels, ointments, topical corticosteroids, medicines that apply directly to the skin. So you're kind of tackling it from the outside. Um, and to the genital sores to reduce inflammation and pain. And then there's also mouth rinses that are quite helpful as well. So there's special mouthwashes that contain corticosteroids and other agents that can help to reduce the pain and swelling of the mouth sores. Um, eye drops containing corticosteroids and other anti-inflammatory medicines can also help relieve eye involvement. So the pain and redness, if your eyes are inflamed and it's mild. So then there's the systemic treatments for Behcets disease. So if the topical treatments don't help, your doctor might recommend you having like internal systemic medications. So I'm not going to list any names of those medications, just because I don't want to provide any medical advice. This is just for awareness purposes only. But they generally will be for recurring oral and genital sores and joint swelling as well. So, severe cases of Behcets disease require treatments to control damage um, from the disease between flares. So, if you have moderate to severe Behcets disease, um, you could go on, like I mentioned before, there's multiple different types of immune suppressants, plus things like prednisolone, etc., that would tackle it systemically from the inside. Um, so, but unfortunately, those medications also have side effects and issues as well, such as like with prednisolone, there is, the side effects of weight gain, heartburn, high blood pressure, and blood sugar levels, bone thinning, so osteoporosis. So the medications that they give, uh, they will only give if they absolutely have to, because they all come with their pros and cons. So they have to outweigh whether the benefits, and safety of the medication versus the disease activity. So the medications that suppress your immune system, so the inflammation associated with Behcets disease can be reduced by these drugs or medications to prevent your immune system from attacking healthy tissues, as it is a autoimmune disease. These drugs can increase your risk of infection. So like for myself, I'm extremely immune compromised. So I will quite often get respiratory infections quite easily. Just about every time I go out, even if I'm wearing a mask, I just about every time will get sick. Um, Also, with cuts, they can end up ulcerating and things like that. So your skin infections. And then you've also got other side effects, including liver and kidney problems, um, and then also anemia, like low blood counts, and then you also got high blood pressure. So the medications can really alter your immune system. So that's why they have to try to outweigh, um, whether it's necessary to actually introduce that into um, your treatment plan. Um, so they may also use the medications in conjunction with the topical treatments as well. Um, so signs and symptoms of Behcets disease, especially for people who had the more severe or resistant symptoms, they can end up having quite um, extreme treatments that usually, I know for in example for Australia, it's not covered on the PBS system, so you have to go through authorization for the hospital to cover it, and the treatment itself comes with considerable risks. So they need to take that into consideration, but sometimes it is warranted. So generally, when it comes to flares, it can be really frustrating, and so it's good to be able to have, if you can, a good support system and coping mechanisms in place if you can, because Behcet's disease is really unpredictable, and it is frustrating. I find it very frustrating because just when I think that everything's kind of getting better, all of a sudden it just comes back. So really, when you're having flares, it's good to rest. Um, and when signs and symptoms appear, just take time to yourself. Be flexible and adjust your schedule where you can. Um, and that way you can rest when you need to. Try to also minimize stress. So taking that time to do self-care things that help you to relax and de-stress yourself. But when you have the energy, try to be active, but not too active to the point where you create issues with your flare-ups and create some more inflammation. So exercise helps to strengthen your body and helps keep your joints flexible, and can improve your mood. So if you get the chance, especially when you're not flaring, to try to even just do small regular walks, also just to get out in the fresh air. That's if you're allowed to go out in the sun. Some medications require that you stay out of the sun, or avoid UV rays, and some people are also UV sensitive. So if you are able to go out in the sun, sometimes it is nice to go out there, get a bit of fresh air. It uplifts your mood, and it gets you out of the same four walls, because I tend to hibernate. I'm very introverted, and unfortunately over the years I have kind of locked myself away, and which I know is not good for my mental health. And so now I'm starting to get up and go out more where I can. Whereas before, you would have had no chance of me getting out of the house. So it's good to try to connect with others, especially in the Behcets community if you can, because it is a very rare disorder and it may be difficult to find others with the disease. So if you can, ask your doctor about support groups, as they may know about some support groups in your area. And if that's not possible to connect with someone close, the American Behcets Disease Association offers message boards and chat rooms where you can connect with other people who have Behcets disease. So there is that option there as well. So just to repeat that one, it's the American Behcets Disease Association, and they do have the message boards and the chat rooms for people with Behcets, which is really good because, like, I know for myself where I am, there really is not many people with Behcets disease, it is extremely rare here compared to other countries because Behcets disease is prominently from the Silk Road. So I have that in my lineage, and so usually that was another thing that they tend to ask when trying to determine whether you have Behcets as well, is what your lineage is because you're more likely to have Behcets if you have uh, your lineage from the Silk Road. So yes, that's our deep dive with Behcets disease. So if you have any questions or you've got any comments or anything you'd like to add, or if you've got Behcets yourself and you'd like to put any comments down, please do. I absolutely welcome them. The next deep dive will actually be on Derkham's disease. So I'll be doing my research on that, and then that's what our next deep dive will be on. Also, if you would like to be a guest speaker, if you have Behcets disease or you support someone with Behcets disease, or even with any other disorder, and you're a supporter, a loved one, or somebody, or a warrior, please do send me a message. I would love to chat with you because I do have some wonderful guest speakers coming up. But I would definitely like to get some more awareness out there and have some more guest speakers. So I would love to absolutely say thank you so much for everyone who has joined me on today's deep dive into Behcets disease. I do apologise about the first live having to be very abruptly ended, but we got through number 2. So yes, so I shall see you in the next video. So like, share, and follow and subscribe. See you in the next video. Bye.